Hi, and welcome to our presentation on childbirth and infant development. I'm going to be talking about the stages of birth. This is Rachel. So there are 3 different stages of birth. The first one starts with early labor, where the uterus is opening and contractions are getting stronger at this point. They're lasting about 30 to 60 seconds, and they're coming to the woman every 5 to 20 minutes. Then we move to active labor, which is the second part of stage 1. The contractions now are becoming stronger, longer, more painful. The contractions are closer together, and more pressure is being felt on the lower back of the woman. As we move to stage 2 of the birthing process, the cervix reaches full dilation, so it's at a full 10 centimeters of dilation, and the woman is beginning to push. This stage can last between 20 minutes and several hours, and it usually lasts longer for first-time mothers and for those who receive certain pain medications. As we move to stage 3, the baby has come out and the healthcare provider cuts the umbilical cord, which has connected the mother and the baby together for the duration of the pregnancy. At the end of stage 3, the contractions will continue for 5 to 10 minutes after the baby is delivered to remove the placenta. The woman may have chills or feel shaky, and typically this part lasts no longer than 30 minutes, and that would be the conclusion of the birthing process.
Hi, this is Winston. I will be talking about the different options for childbirth. There are 4 main options: hospital, home birth, midwife, and doula. A hospital offers the most safety in general. They can take the most measures to protect both the woman and the child, and you're going to have direct access to doctors with a lot of experience, and a NICU if you need it for the child. On the other side of the spectrum is a home birth, which doesn't necessarily include a midwife. You can do it by yourself, and you're kind of just having a baby in your house. A lot of people do this and have good results with it, but there are higher levels of children having seizures and different complications during birth. A midwife offers care mainly like the day of and throughout the birth, but not really any care following the birth and not care beforehand. But a midwife offers a lot of experience and can help deliver the baby in someone's house. And then finally, a doula offers care throughout the entire pregnancy, and they offer care for the people throughout the pregnancy and shortly after.
Hello, this is Claire. I'm going to be covering the measures for neonatal health and also what a low APGAR score indicates. So first, when it comes to measures for neonatal health, I'll just be going over 2 examples today. The first one is the APGAR. It's a measurement scale that assesses and quantifies the health status of a newborn. It's typically conducted shortly after birth, and APGAR it stands for appearance, pulse, grimace, activity, and respiration. The second assessment I'll be briefly going over is the Brazelton assessment for newborns. It focuses on responses to stimuli. There are 28 different stimuli that this test assesses, and this is a lot less common of a test. It needs to be done in a isolated room without other variables. Some of the things that they measure are motor tone, activity level, self-regulation, stress responses, sensory and social capacities. This needs to be done by a trained professional, so once again, it's not as common as the APGAR assessment. So going back into the APGAR assessment, what does a low APGAR score indicate? Well, the scoring can be broken up into 3 categories. There is 7 to 10, which is a pretty reassuring score, 4 to 6, which is moderately abnormal, and 0 to 3, which is a high-risk score. So the lower the score, the higher the risk, basically. If your child or your newborn, I guess, has a low APGAR score, some of the things you can do, it depends on how low it is. This could be life-threatening, and they should be taken into intensive care right away. But if it's a mid-level score, some of the things you can do to support your child is keeping them warm. Obviously, temperature really matters, as well as maybe implementing special feeding procedures, helping them breathe, massaging them, and also just minimizing sensory input, so keeping light low, noise levels low. Yep, that's it for that section.
Okay, final section here. We're going to be talking about bonding with your infant. This is a really important step to a newborn coming into the world. Physically, sometimes the baby is going to need more skin-to-skin contact, especially if their temperature is really low. This has to do also with the previous section of the APGAR score. If their score is really low, then they're going to need more skin-to-skin contact than a baby who has a really high one.
They also, if they're premature, will have difficulties with regulating their temperature. As a parent, getting support from people around you can help you be more emotionally present for your child. And a lot of premature babies cause a lot of strain on parents, so it's important to have that support system around you.
Lastly, psychologically, if the parent can't be there due to the baby being in the NICU, being premature, or having some health issues that cause them to have to stay in the NICU for longer, the parent can leave sentimental items with their child that smells like them, or something that can remind their child of them, so that they can feel comforted and loved while they're in the NICU for the time being.